Good day, I'm Caroline Brown-Thompson and this is your JIS News for Monday, March 17. The National Response Team, led by the Office of Disaster Preparedness and Emergency Management, continues to monitor the situation at the RIVERTON City Disposal Site, having contained the fire that started early Sunday morning. Shortly after the fire started, ODPEM activated its National Emergency Protocol. The Jamaica Fire Brigade dispatched 7 water engines with aerial ladders, foam and tractors to bring the blaze under control. ODPEM now says the smoke nuisance and levels of toxicity have been significantly reduced.
There are a number of trucks that is working in the area. We're getting supplies from the quarry by ferry. So we're moving dirt from that location to the Riverton City location to push dirt onto the fire, as well as pouring water. So it's cooling the area and putting dirt on the site to suppress the fire.
Businesses and schools in the environs were given the green light to open Monday morning. The general public is still advised to continue observing the necessary safety measures to reduce smoke inhalation and mitigate respiratory conditions. In other news, Western Jamaica is in line to get a highly specialized general hospital that will significantly advance Jamaica's drive to develop health tourism. The 22-bed facility will be built through a $20 million investment by Spanish firm RIVERTON Group. Prime Minister Portia Simpson Miller has welcomed the investment and called for others to follow the example.
The decision by the RIVERTON Group to commence construction of this highly specialized general hospital in the heart of Jamaica's tourism industry comes at a time of improving economic stability, supported by positive ratings by the international rating agencies. This investment represents a tangible outcome of Jamaica's tourism master plan and the work of successive governments.
The 3-story hospital will be constructed on land that the company acquired at Red Girl in Cinnamon Hill in 2008. 300 jobs are to be created in the construction phase, which should begin shortly and be completed by the second half of 2015. The primary target market for the hospital will be tourists in Montego Bay, Ocho Rios and Negril, but locals will also be welcomed at the health facility. To complement the project, the RIVERTON Group will be establishing 11 nursing stations along the north coast, as well as clinics at the new Falmouth Pier and the Ocho Rios Cruise Port. Meanwhile, a demand study program is to begin within the next 2 months to determine the needs of the tourism industry and resulting investment opportunities. The study will be carried out by the recently established Tourism Linkages Council, which comprises 19 members representing various stakeholder groups in government and the private sector. The council's chairman, Donovan Perkins, says the aim is to fully integrate the operations of tourism and other economic sectors and reduce the need for importation to fill the demands of the industry.
Everybody's excited about the research project because what it will do is it will provide the information for all the segments to look to see where it is that there are opportunities in the market for their businesses. We've designed the research instrument, the funding is in place. What we now need to do is to gather the information.
Mr. Perkins was speaking at a recent JIS think tank session. Over 80 beneficiaries of Phases 3, 4A, 4B and 7 from the ARNETT Gardens community recently got titles for their properties. The titles were handed over by the Ministry of Transport, Works and Housing to those beneficiaries who have completed payment for land they've occupied for a lengthy period. Portfolio Minister Dr. Omar Davies said the lives of the beneficiaries would be transformed as they would no longer be termed informal settlers.
But you'll be people with your house with legal documentation that you are owners.
And finally, the Jamaica Athletics Administrative Association, J3As, says it will be implementing changes to its management of athletes representing the country in the wake of the recent death of Kavon McKenzie. The 18-year-old St. Jago High athlete died in Trinidad after completing a cross-country race on February 22. Speaking at his funeral on Sunday, J3A's president, Dr. Warren Blake, said the young athlete's untimely death would propel changes going forward.
We cannot afford to have this happen ever again. And in future, when teams go away, as president of the J3As, I'll be endeavoring to ensure that all athletes who go away will have a pre-medical examination before they depart to represent the country in an effort to try and reduce the prospect of this ever happening again.
Among those who paid tribute to Cavan on Sunday was the Minister with responsibility for sport, Natalie Nita Headley, who represented the Prime Minister at the funeral. And that's it for JIS News today. I'm Caroline Brown Thompson. Thanks for watching.